Hello. One of the things that's been a real privilege as the dean of this law school over the past few weeks is being able to talk to so many of our alumni around the country and learn about how they and their practices and roles are coping with this COVID-19 epidemic and in many ways leading their communities and institutions to respond to it. One of these alumni who is doing amazing work is the mayor of Dallas, Eric Johnson, who finds himself in the incredibly important role of leading one of America's major cities through and out of this public health crisis. I recently had the opportunity to record an interview with Eric Johnson about his role as mayor, about his path from Penn Law to the mayor's office over in less than 2 decades. And the first question I asked him to speak on was just the amazing change in his role over the past year. And I asked him how this has differed from the expectations as a first-year mayor and how he and his team have adapted and worked together on behalf of the city of Dallas to respond to the public health crisis.
Our city got hit with an EF3 tornado that came right through the middle of Dallas, which is actually quite rare. I mean, tornadoes that don't frequently just come right down the middle of a metro area in Texas like that. So the damage was very, very extensive, and we had a lot to deal with that. So that's just a few months into the job. So I got my first taste of crisis management then. And now, of course, this is the crisis of all crises. I mean, this is an unprecedented, or certainly in modern history, unprecedented type of an event for us. So one of the lessons I have learned, though, by starting with the tornado and moving to this crisis, is that one of the main roles that a mayor plays in a situation like this is communication. You have to be able to make sure that the folks in your city know what's going on and be very transparent and explaining, being a good explainer of things and keep people calm. In spite of the fact that things may not always be going very well, or things that may be more complicated than folks want to know.
So how do you communicate? Do you use TV? Do you use TV press conferences, social media, the newspaper? What is
all of the above? But in the case of COVID-19 and with respect to the hospitals, one of the first things we did before we ever got our first case was make sure we got all of the folks who would be affected by the spread of this disease together. Back then, we could actually meet in a room. So we got everyone together from our hospital community, all the CEOs of the major hospitals, plus our university presidents and our school superintendents. Everyone you would imagine who would be affected by this, who was going to be needed to help us slow the spread of the disease, we brought together and we talked about what our plans were going to be once this thing started to spread. So our first job, I think, in this situation was to bring everyone together, make sure we were communicating with each other. And then we started to make sure we communicated externally to put the public at ease and to make sure that they understood what was going on. And those are all the things you just mentioned. We use the media quite a bit with press conferences and giving interviews to reporters. We also rely very heavily upon email communication in my office. We try to give people regular updates on social media. We really try to hit every avenue that we think people use to get their information. And so I think we've been pretty effective in doing that. And so communication is a big deal. And I think coordination with all the different levels of government is also important. So we've been making sure that we are in lockstep with and in constant contact with our federal partners and the governor and our folks at the state level who deal with emergencies, and also the county.
Yeah, I'd love to continue that thread in terms of sometimes for those of us who aren't in government, there can be a question in this era about who's in charge or the conflicting things. And you've obviously got Governor Abbott, who's been out front to kind of lift some of the restrictions. You've got the federal government saying other things. How is that? How is that working with other levels of government? Are there any challenges you're willing to talk about? Are there successes you can tell us about?
I think we've done a very good job actually here locally and working together and in communicating. But I will tell you, I think it's a great question, because I do think that there is a tendency in the media sometimes to try to find those situations where there's been miscommunication, or where there appears not to have been great coordination to see if they can expose a possible rift or a difference in opinion about how to approach something that falls along partisan lines. But I've really strongly resisted that. I served in the Texas legislature for about a decade, and I was a Democrat, elected to the legislature, but the mayor's office in Texas is a nonpartisan office. And so I'm elected to be mayor of Dallas on a nonpartisan basis. And I've tried to govern that way. Meaning I've tried not to get involved in what I view are primarily partisan fights. I've tried to just do the job of leading our city based on data and trying to do what I think is right from a policy standpoint. So what that means in this situation is I've not allowed the partisan affiliation of any of the folks that I have to work with, whether or not they are U.S. senators or our congressional delegation, our governor, our county judge, which is what we call our county executives down here. That doesn't matter to me. What matters is that we try to do everything we can to make sure that we are protecting lives here, and that we're protecting people's livelihoods and making good decisions. So I've been sort of at the heart of trying to coordinate all the different levels of government here locally to make sure that we're working together. And I think we're doing a pretty good job.
Mm-hmm. So, one of the difficulties of your job, besides protecting lives, you also want to protect jobs. You want to protect the economy of the Dallas area. And can you speak to that real kind of the difficult trade-off, if it is a trade-off, and how are things going in terms of business, unemployment, and as you look ahead, what are you working on there?
Oh, it's an understatement to say it's a trade-off. I mean, it is it's the thing that keeps me up at night the most, and it's the thing that was probably every difficult decision that I've had to make throughout this process. Going back to whether or not we were going to have a St. Patrick's Day parade or not. And believe it or not, that feels like a year ago, that decision. Yeah. But it wasn't that long ago.
For me, yeah.
Yeah, it wasn't that long ago we were trying to decide whether or not it was a good idea to have a St. Patrick's Day parade in Dallas or not. And I can still remember there being actual medical professionals and folks who weren't convinced that it couldn't be done. I mean, it was actually a real robust discussion at that time about whether or not you can go forward with it or no, you can't. Ultimately, we decided not to. I was always pretty much leaning against doing it. And we got confirmation from most of our hospital leaders, and ultimately our health authority in Dallas is our county. They actually are in charge of public health for the city. They gave us their opinion, which was that it would be best not to have it. And so we decided not to. But from that point on, the decision to then close down all of our bars and limit our restaurants to takeout and delivery only. And then, of course, when we went to stay at home or shelter in place, whatever different people call it around the country, at every point, what weighed on me the most was this is going to hurt a lot of people economically. This is going to cause some people to lose their jobs, for sure. In the most in extreme cases, it will cause people to possibly even lose their shelter, to become homeless. All kinds of bad outcomes were possible. And, that weighed very heavily on me. But I wanted to make sure that we did everything we could within reason to protect lives and save lives. So that balance, that trade-off is the ultimate public policy conundrum. And we're still working through those decisions. And, I don't envy the governor of Texas for having to decide. And it is you asked earlier about, who has the ultimate decision to make. And is that clear in Texas? The answer is it's very clear in Texas. We have a law called the Texas Disaster Act of 1975 that says it's the governor's ultimate call, and that his orders trump any local ones when it comes to emergencies. So, now that decision has been made, we're all trying to make it work. His orders to reopen our economy starting on Friday with 25% occupancy levels. We're trying to do that as safely as we can.
Yeah. How about the Dallas School District? Is that your authority? Is it the governor's? Is there a separate board? And do you think that primary schools, elementary schools would reopen before June?
In Texas, school districts are independent school districts, and they have their own boards. They hire their own superintendents, and they only they are governed by the Texas Education Code, which is where obviously the state statutes are housed dealing with education. So they do not report to mayors or county executives. They report to a commissioner of education at the state level. And the governor in an emergency has sweeping authority to order any movement of persons or eliminate movement of persons, including school children. So he has ordered schools closed for the remainder of the year. So that has also been decided. And, since we think we know that children can be very efficient spreaders of this disease and oftentimes are asymptomatic, that makes sense from a public health standpoint, but it's certainly difficult on the parents. And I can tell you, as the parent of a 5-year-old who actually just turned 6 years old on Saturday, and a 2-year-old, and my wife works also and has a job outside of the home. That's very challenging with kids not being able to go to school and with daycares being closed.
To do kindergarten via remote learning, right? Yeah.
So it's very challenging. It's very challenging.
Have you been going into the city hall? Do you work at home in terms of your day? And do you have staff around you, or is everybody was there a period where even your closest advisors were remote as you were running the city?
It's been a progression where we were going into City Hall every day for a while, and then we started going in only for council meetings and press conferences and things. And now, for the most part, everyone is working from home unless we absolutely have to go into City Hall for some reason, and that's a rare occurrence. Usually, we can do what we need to do, like you're doing right now, through video conference. Our meetings have gone, our city council meetings have gone to video conference. Our board and commission meetings, to the extent that they're still happening, have gone to video conference. Occasionally, we have to do a press event at City Hall, but we try to keep those to a minimum even. So for the most part, we're working remotely now, and it's working fine, but it's a little more difficult to conduct the meetings that way.
Yeah, but you are doing like city binding resolutions and city business remotely.
City government is still moving forward in Dallas. That's been something I've been very insistent upon, to make sure that we haven't just completely stopped the wheels of government from turning, but COVID-19 response is really, really important, because from a financial standpoint, I'll just say this, the projections are already pretty dire for the impact that this is going to have on our city budgets.
Yeah.
I don't know how familiar the folks who are watching this are with city budgets and how they're put together, but sales tax is a big part of it, and that's taking a major hit right now.
Yeah, we're having it in Philadelphia. And are you having the it seems like no city has it worse than Houston because of everything with the COVID budget hit, as well as the energy. And is Dallas, my sense is Dallas is, you've got a more diversified economy, but are you also suffering with the kind of energy prices dip and the oil dip?
Well, energy sort of, is something that affects our entire state. Our entire state's economy is impacted by it, but you're right. I think, Houston is a lot more energy industry focused. And so the impact there will be the most severe, I think. Dallas is a more diverse economy, and that's something that I'm very grateful for. Dallas has a pretty robust tech industry. It's got more tech workers actually here than we do in Austin, even though Austin gets the reputation for being a tech city. We've got a very vibrant telecommunications industry. We've got a vibrant service industry, a lot of restaurants. It's a very, very vibrant business community. Healthcare, it's very diverse. So that's helpful. But the reality is no one's going to escape. No municipality, because of the way our tax system is built here in Texas, is going to be able to really come out of this unharmed. And we're looking at potentially in our next fiscal year as much as $134 or so million of lost revenue in the form of tax revenue, which is a huge amount of money for a city that spends 2/3 of its money on public safety. And we want to make sure that we're able to continue to provide services like public safety. So we're going to be working on that for the foreseeable future.
How concerned are you, and both with the impact of the COVID disease itself and the economic kind of a disparate impact, where it's hitting minority communities harder, whether it be the disease or the layoffs. Is that happening in Dallas? And are there steps you can take to rectify some of that?
Well, I grew up in the part of, I'm a Dallas native, and I'm obviously African American, and I grew up in the portion of our city where that's the most diverse from an ethnic standpoint, and has, I guess, the lion's share of our city's lower income residents. And so I just, in everything I do, I bring sort of an equity lens to the table and see disparities and am concerned about those disparities. And so I've been asking for data, and we've been getting data from our county about what we can tell about who the disease is affecting in terms of who's contracting it, what the positive cases look like from a demographic standpoint, and then of course who is sadly passing away from it. The reality is, on the surface, the numbers in Dallas County actually don't suggest right now a disparity in who's getting the disease and testing positive and who's passing away. African Americans and Latinos do not appear to be getting the disease or dying from the disease at a higher rate than whites. However, what we are concerned about, and we don't have the statistical analysis completed yet to be able to say this with any certainty, but certainly everyone, I think, has heard around the country about the lack of testing and just the lack of availability of testing across the country. Texas and Dallas, specifically, are no exception. We have not tested anywhere near the percent of our population that we'd like. We're at about 1% of our total population countywide that's been tested. The concern that raises for me is that it could be potentially the case that we just haven't tested enough in our lower income communities or in our minority communities, and perhaps the numbers just aren't reflecting the reality of infection.
Mm-hmm.
Then maybe there's more undetected.
This gets at that question of kind of intergovernmental relation. Like, are you competing with Houston and Austin for tests, or is the state going in together, or is it private industry? Are you all kind of chasing a limited number of test kits?
That's a great question, and I don't think that we are competing per se with our neighboring communities or our cities, the major cities in Texas. I know that the governor has a plan, and he's announced that he's trying to bring more tests and more contact tracing to Texas. I think everyone is just doing everything they can, and I think that we could probably stand for there to be more coordination and the effort to make that plea to the federal government. But I think everyone is saying the same thing, even without coordination, which is that we would love to have more federal support and more federal resources for testing, because it's so important that we have that information to know how this disease actually works. What's mind-blowing about this, to me, as a person who, I got my law degree from Penn, but I was a JD MPA, and I got my master's in public affairs from Princeton. Data is how we make decisions in public policy. That's really what that whole degree program is about, is how you take information and data and make good decisions to maximize public value with. Well, we're missing some critical data here, which is, how this disease actually spreads, who it's affecting. All that stuff is stuff that we really need to know, and we just don't. So we're trying to do the best we can with limited information right now, but it's on everyone's mind.
Yeah, it's, I can only imagine that the tough choices you need to make in a world of unlimited information. And we're all, there's folks across campus here working on that. I hope I can connect you with some of them, and let's go back, before we close, and we're really proud of the work you're doing.
Thank you.
Take us back really just barely over, you were elected mayor kind of on your 15th graduation, or 15th or 16th anniversary of graduation from this.
Don't make me do math. Don't make me do math.
Yeah, well, I'm already messing it up too. Two lawyers, we're not gonna, but basically at a very, early stage in your career. So, and you were in the state legislature before that. Can you for those listening, take us through like what led you to enter public life so soon, enter the legislature, and and then make the big step to run for mayor. It's something, we'd like to see more of from our graduates in the first decade or two. And what inspired you to do that, and what advice do you have for folks who would want to do that in their own communities?
All right, well, let me say this, I'm very grateful to Penn Law, because Penn Law actually played a pretty big role in this whole deal, and I'll tell you how. So when I graduated from college, I actually went to work in the state legislature after graduation for the length of our legislative sessions, about 5 months or so. So I did that, and then I applied to graduate school in public affairs and then law school the next year to do a joint program. So I was admitted into Penn Law, thank you very much, as a public service scholar. So I think public service was something I knew that I wanted to do way back when. And Penn helped make that possible. The education I got there, the summer experiences I had. I worked for the U.S. Attorney's Office for the Southern District of New York and the Philadelphia Legal Assistance Program. I did a lot of public service things while I was in law school that really just sort of solidified for me that that's what I wanted to do. So this was a sort of a, something that I knew early on that I wanted to use my legal education for. I ran for the state legislature not all that long after I got back to Dallas, started practicing law. And then what happened essentially was the district that I grew up in and that I lived in when I moved back to Dallas, the representative before me found herself in some legal trouble and ran for re-election while she was under indictment. And I ran against her and won, which was actually, believe it or not supposed to happen. I was really expected to lose pretty much in every Democratic Party circle you went into. I was pretty much counted out, but I ended up winning that race and had a 10-year career in the legislature where I focused a lot on educational opportunity, which I credit for, being in the position to serve in the legislature and to become an attorney and do all the things I was doing. So after about 10 years there, basically the mayor's job jumped out at me as an opportunity to serve my city that I love very much, and to do so on a nonpartisan basis and not have to deal with sort of the Democrat Republican, the constraints of that. Just to be able to do more pure policy. And so I tossed my hat in the ring last. There were 9 people running. I was the 9th person to jump in, and it worked out. So since I've been mayor, I've been working on, before COVID-19, trying to do some things around workforce development in our city and to prepare our city for the future in terms of preparing the parts of town like the one I grew up in for the jobs of the future, and also doing some things on ethics reform and some other things I think are very important for the city. So that's been my path, and I think Penn Law has been really instrumental to it. So I just want to say thank you. Well,
thank you for doing us proud, and I hope and for spending time with us. This is really interesting. I could keep going, but we need to
I wish we had.
So we need to bring you back, and either virtually or certainly when we're able to congregate in person. I'd love to have you speak with our students up here, and I suspect you may have some who want to volunteer for you and work on the really important issues you're working for in Dallas, and we'll try to make that happen. But Mayor, thank you, and best of luck in dealing with this really huge challenge you have that you're meeting really well.
Well, thank you very much. You guys are going to be in my thoughts. I just want to say to you, and to all the people at Penn, please stay safe, and to all the graduates, congratulations. I know it's a very different scenario than anybody probably could have possibly imagined they'd be graduating under, but congratulations to you all, and best of luck to you in your careers.